Hi, my name is Stacy Van Buren, and I'm here to share a story with you. It's not a happy story, but it's my current ongoing story about what we think is cervical cancer. Um, I do my yearly, visits to the doctor, and I've done that. And this last time, it was a major surprise. I got a call from the doctor, and anyway, it was a really bad test result, and I'd had a result a year before, and it was fine. 2020 hindsight, the doctor was like 120 years old, so I don't really trust what it said. So I'm very, very nervous at this point. But apparently, I have as bad as it can be, and I'm waiting for a biopsy to find out exactly if it is cervical cancer or if it's just as bad as it can be without being cervical cancer. One of the biggest obstacles, though, is the fact that I have no health insurance. And I'm actually a licensed health insurance agent, which is a funny little deal. But I don't. With the economy as it is, it was that or not put food on the table. And so I chose to drop my health insurance, and certainly didn't go to the doctor thinking there was a problem, but apparently there really is. I have 4 kids, the 4 most amazing kids in the world. And I haven't told them yet because I don't have a diagnosis yet, but I'm going for a biopsy tomorrow, and hopefully I'll know what's going on. The doctor I went to, she's not a gynecologist. She did the tests that I needed there, but anything further, I had to go find a specialist, and just seeing her was over $350. She referred me to a clinic. I went to the clinic. I was given the runaround. I was there for 3 hours. I spent the time waiting, crying, or fighting with people. And I was always thrown and put on the back burner until they saw this paper. I call it my golden ticket. Certainly not Willy Wonka's version, but when a doctor finally would look at this test results, they started moving and freaking out. And they wanted to give me an appointment a month later, and I said, that's not okay. I need something sooner. And finally, I'm not somebody that argues all the time, but I got in the nurse's face, and I said, look, I know you can do something if you wanted to. She got snippy with me, took the test results, and said, fine, I'll go talk to the doctor. She came back, and she was almost crying, and told me that the doctor said to go to the emergency room. And apparently what he said was, she's too far gone, send her to the emergency room. So I went through all of that. I ended up in the emergency room. It was 11 hours of hell. It was ridiculous, how many people were there, and they weren't true emergencies. They were there to see the doctor, just like I was, but I had to be seen. And each of the nurses I saw told me, don't leave. They said, I don't care how long you have to wait here, don't leave. You have to be seen. So I waited, and anyway, because of that, I now have the appointment that I need. It's scheduled for tomorrow. I'm hoping to get some results soon. I don't know how long it's going to take, but yeah, I wish I had health insurance because I wouldn't have had to go through all of that. You shouldn't have to sit in the emergency room to get the test that you need, and I'm scared out of my mind. I don't know what's going to happen. I don't know what's next, really, but that's the story thus far.